So let's talk about COVID. And I've got some friends who've got some kind of weird, uh, post. They think it's COVID. They've
Yeah.
lost their taste. Some have lost their smell. And let's talk about some weird things that people might be trying, and if any of those are worth trying or not.
Yeah. So we've always had patients that lose their sense of smell after they have a viral infection, like a cold or such. My
Really? I
father-in-law
didn't
actually,
know that.
yeah, it's not common, but it happened in the past. My father-in-law had this happen to him, and his took a long time for his sense of smell to come back. Um, but right
And was
now,
that with COVID with your father-in-law?
nope,
Or was this
just a regular cold virus. So this has always been around. But it's interesting, and I think it's for two reasons it's happening right now, is that everyone is getting COVID in a short period of time, a new novel virus that they've never had before. And in other times when people get viruses, it's over many years, right? So now we're seeing it in a very compact window that people are getting the same virus and having the loss of smell associated with that. There probably is also a component of this particular virus hits the smell nerve more than other viruses do. And so we're seeing smell loss as a very common symptom for this. And we're also seeing a lot of patients who that's their only symptom they're having.
Hmm. And like, so, smell and taste, they seem to be, I would think they're connected. Is that right?
Correct. So it's actually the easiest way to explain it to patients is that taste is only about 10 to 20% of flavor. And most of us say something tastes good, but really what we're saying is the flavor of this is good. And about 80 to 90% of that is smell.
Really?
So when you lose your smell, all you get is sweet, salty, sour, bitter, which is on your tongue, and you don't get that true sense of flavor like you would bite into a pepperoni pizza and you can tell it's pepperoni because of the smell component.
So, I've seen some studies of where people, with essential oils to get their smell back, or I think kind of extreme smells,
Yeah.
to kind of get things back. Is that worthwhile to try?
Yeah, so the way that smell works is we have molecules that float through the air. They have to get to the top of our nose where the nerve then recognizes the shape of that molecule. And then it tells our brain that's what it smells like. When it's injured, it doesn't pass along that whole signal. And so from our studies before and what we know now, strong smells, or essentially we call it retraining therapy, is what can help along that pathway. So whether it's essential oils, the studies that we do, we actually have sticks with oils on them that are very strong smelling, whether it's lemon or coffee, etc. And those are things that our brain is used to recognizing. And so as the nerve grows back and recovers and it gets those shapes, it's practicing, right? It's just like if you want to be a good soccer player, you have to practice at it. That helps bring your sense of smell back.
The man I interviewed today, he loves peanut butter. He says peanut butter tastes like sewage now. Should he do this smell training to try to get that taste back?
Yeah, that certainly can help. The biggest thing is time because the nerve, when it's injured, can take up to 12 to 18 months to recover. And it doesn't always recover. But if it's going to, it usually does earlier than that and smell training along the way. One of the things that he said is it tasted like sewage. That's really common as it's recovering to have bad smells or stuff tastes like smells like smoke all the time. So
Mm.
that's actually a kind of good sign because it means the nerve is starting to recover.
Should people try some of these things at home, or should they talk to a doctor about, like the essential oils and the smell sticks, that type of thing?
Yeah. So if you don't know if you've had COVID or not, and you have a loss of sense of smell, you need to go see your nose and throat doctor because it can come from other reasons. They could have a tumor in their nose. There's all sorts of things that we want to make sure of first. And oftentimes we'll actually COVID test those patients to see if they have antibodies, and that tells us if that was the cause. But as far as if you know you have COVID and you have smell loss, go for it. You can do these things. You read about it on the internet. There's kind of instructions of what the different things, and that can help you as you go along that recovery journey.
So would the smell, like, smelling like an essential oil, like, is there some that work versus others, or can you really try any of them?
Yeah, we don't really have great science on that. We do know that the ones that we've used in our studies, from lemon to coffee to peppermint, all of those are ones that are strong smells, things that we use in our perfumes and such. So probably more along those lines, things that have a potent smell, and obviously ones that smell good, those would be ones to start with. From a tips perspective, most people are going to have things around their house, oftentimes things they liked before, whether it's coffee, lemon, peppermint, etc., and just start with what you have.
And should people be like visualizing what they remember the smell to be while they're doing these things? Does the mind play any factor in this?
Absolutely. And in our brains, our smell organs is right beside our memory organ. So oftentimes smells and memories are tied very closely together. Like you may remember the smell of the room at big events in your life. And so it's that same sort of thing. You want to remember good memories associated with good smells, and that will help the process. Honestly, what most people are going to say is you just got to give it some time. And
Really?
most of that gets better as the nerve settles down and isn't overfiring like it was before.
Sure. Okay. Well, I think we covered everything. Is there anything you want to add? Like, so are you part of these studies at SLU with this smell thing?
So a lot of the smell nerve studies have been done in the past,
Mhm.
and I've talked about this with my patients, that smell is almost like the forgotten sense, in
Mm.
that we have great research dollars for hearing, for sight, whereas smell, we've never put our NIH dollars behind that, but a lot of investment is coming right now because this is a common thing. So
Mm.
I think 5, 10 years from now, we will have better answers and treatments than we've ever had before.
So let's talk about taste and smell, and that people are losing it after COVID. And this is not uncommon for people to lose taste or smell after a virus. Is that right?
So it's not uncommon for people to lose their sense of smell and taste after the rhinoviruses or the various types of viruses that we know as the common cold or things like that. And, it's not uncommon, but it's not that common, quite frankly. So what has been really unique about the COVID infection pandemic are the numbers of people who present with loss of smell and taste as one of their presenting symptoms. That's quite a bit more than what we've seen in the other viruses. And then the percentage of people who have persistent change in smell and taste. So the long-term symptoms of COVID, again, are a lot more than we've seen in the past.
And are you involved in any research with, this type of getting people's smell and taste back?
So currently we have two studies underway to look at treatments for loss of smell as related to the COVID infection. And the first trial has about 400 or so people from around the country. It's called a virtual trial. So we actually don't have anybody come on the WashU campus. We interact with them through the internet. We have people from Montana and Manhattan and Missouri and all over the country. It's really quite cool. What we're asking in this trial is, does the olfactory training, the smell training work? And in particular, does olfactory training work when the patients themselves get to pick the smells that they train on?
Hmm.
Traditionally, scientists have felt that particular smells like eucalyptus, clove, lemon, and rose need to be the four smells.
Hmm.
And in some preliminary work we did here before COVID, many of our St. Louis patients asked, what's eucalyptus? Why do I want to train on that?
Sure.
I really want to smell the following. And they would tell us the things that so that got us thinking, hey, why don't we let people pick the things that they want to train on that's important to them? And Tracy, what was really interesting was smoke was the number one thing that when given a chance, people would like to train on to improve because they're so afraid of not being able to smell smoke as a safety issue. Anyways, that's a little bit of an aside. So
Fascinating, though. Fascinating.
one arm of the trial is that people get to pick their own, or they get assigned the four essential oils that are traditionally thought of as part of olfactory training. The other arm of the trial is people are actually looking at the items that they're smelling. So it's two senses, visual with the olfactory. Does looking at the object help recreate the memories, help train the brain in the new, or to get back those smells over just smelling alone? So that's one trial.
Yeah.
And then the other trial is using a medicine called theophylline. So theophylline has been around for a long time. It's a treatment for asthma. And we're thinking, can we repurpose it for the anosmia from COVID? There's some biological reasons to think that theophylline can help turn on the neurons up in the nose and get them working again. So we have about 55 subjects right now in that trial using theophylline in a nasal rinse every day for about 6 weeks. Both trials should be done about mid-June, early July, and we'll have answers then.
Great. And we focused a lot on smell. Some people are still complaining that they've lost their taste or certain things, like peanut butter. I just interviewed a guy who says peanut butter tastes like sewage. I hope he doesn't know that from, basis, but that's what he's saying. Does like the nose play a factor in that, or could that be a totally separate thing?
So the senses of smell and the sense of taste are related. And if somebody's lost smell, that will impact their ability to taste foods. And we are seeing that with COVID. Patients can have sense of smell alone, sense of taste problems alone, or a combination of the both. That's for sure. And then Tracy, let me answer your other question. Another interesting phenomenon that we're seeing with the COVID-related smell problems are what are called parosmia. And parosmia is a distortion of smell. Again, like the other viruses, parosmia or smell distortion with the recovery is well known. But what's really unique about COVID, again, are the numbers of people who are suffering parosmias. And the typical story is one of a patient loses their sense of smell with the acute infection. The sense of smell and the other symptoms of COVID infection are getting better. Sense of smell is getting better. And then it seems to plateau off. It's not back to normal. Either the smells don't last as long, they're not as strong. And then in some of these patients, it actually changes so that they get a distortion of the smell, so that foods smell rancid, or they smell sewage or poop smell, rubber, burnt rubber, fire, things like that. It's very disorienting for the patients. And we've had people say, doc, when I had no sense of smell, that was better than what I have now. The parosmia can be very disturbing. We don't have any specific treatments for the parosmia. We believe that for most people, that just kind of gets better over time. We think it's a reflection of the nervous system trying to repair itself, and it just takes a while to get the connections right, but it will eventually. But we don't know with COVID. We just don't know long-term what's going to happen.
And if people have had COVID and they want to try to get like their smell back, do you recommend that they try, I don't know, sniffing, this eucalyptus oil or lemon, or maybe a smell that they've really loved in the past?
Yeah. So we don't really have any evidence-based or proof of treatment success for the COVID-related olfactory problems. And so what we recommend are the olfactory training programs, the smelling these essential oils. And my hunch, it probably doesn't matter which ones the patients pick, but the ones that are important to them, coffee, vanilla, whatever. And the process of doing that on a regular basis and imagining what those smells, remembering what those smells are, may be the best form of treatment. There are some medications like steroids and things that could be tried, but there's no evidence that those work. We're going to be looking at some other treatments like vitamin A and alpha lipoic acid and some other things. But again, nothing out there for sure.
And to some people, this might seem like a minor, bother. Do you think this really is a real issue for these people?
Absolutely. the loss of smell can be a real issue for these people. And what we hear is, I never realized how important it was until I lost it. Now, some people who earn their living from smell, like chefs and sommeliers or wine stewards, obviously that's devastating. But for everybody, just think about it. The loss of the ability to smell something like smoke or natural gas creates a considerable amount of anxiety. So it's one of those silent conditions. Nobody knows you look the same, but it really is a problem, a disability. And what we're noticing now is that the predominant people with this loss of smell are younger people who, if it doesn't come back, are looking at the rest of their life with this disability. And that's not really very nice. We know that older people suffer loss of smell, and that's where most of the statistics come from about loss of smell in America, is an older generation. But again, what's unique here is the COVID people are much younger. And consequently, if we can't find a treatment, they're going to be living with this problem a lot longer.
Should people be comfortable with diagnosing themselves with this olfactory thing, or should they go in to be seen to make sure it isn't something else that has nothing to do with COVID?
Yeah. So for a person who wakes up and senses that their sense of smell is not right, there are some simple things that they can do, like smell different items in their kitchen to get an idea if their sense of smell is really affected. And of course, if they have some of the other symptoms like fatigue or cough during this pandemic, that strongly suggests that they have COVID. But we've been working on some research to develop a real simple household test that people can use in their house, and particularly in their kitchen, to get an idea if what they think is going on, that is, they can't smell, in fact, is what's going on. And we found that they're very accurate. Now, ultimately seeing a doctor, making sure it's not one of the other causes of smell problems like a tumor or polyps or things like that would be prudent or would be wise. But for somebody who wakes up and says, hey, I can't smell, there are just some simple things that they can do, like reach into the refrigerator or reach into the cabinet and try to see if they're able to smell these items that they've been able to smell in the past, like cinnamon, like vanilla, like spices.
And have you always researched smell?
We've been researching smell for about 8 years now, so well before COVID. But certainly with COVID, the urgency of the research findings, the volume has really taken off.